Okay, thanks. And we also want to mention our colleague Christy Cavier. She's on our list, but she is not here today. We're going to just talk a little bit about our objectives and just kind of talking through like what we're going to look at for today. We're going to explain some of the benefits that we've found from our interprofessional simulation, and then some feedback, like determine ways that we got feedback to kind of help improve our process, and what we use to help build collaboration in these environments. So we wanted to really first focus on like why this really matters, and some of the things that I think when we're looking at like education activities and things that we want to do, we have to just really remember like the background of why these things are important for us. And one of the things that we really wanted to emphasize when we were thinking about why this really matters is kind of talking about like what we want as goals for our nurses that we're developing in our practice. And so one of the things that like we really wanted to focus is on, like right now our healthcare setting has changed so heavily. And so when we kind of really think about like how much our healthcare settings change, we really need to graduate nurses and nurse practitioners that are really strong graduates, that they're able to kind of work immediately when they start their practice. And so when we were kind of looking at this, we wanted to make sure that they could do strong teamwork and they'd be able to kind of work in these teams. Another priority that we really wanted to make sure that we were emphasizing in education was like that we were focusing on real world dynamics. Very specifically, like what it's going to be actually like when they work in practice. A lot of times when we are teaching people, we are emphasizing like, oh, this is what we really want you to do in your practice, but pretend like you're going to be doing that, but not actually simulating or having them do the real things that they're going to be doing on. And one of the other things that we really wanted to focus on was enhancing their clinical reasoning, not reading. I actually would like them to do critical reading, so anyone else in here, I would like that too. So that's probably why I said it. And any reading at all, actually, even one, I think would be nice. So and clinical reasoning and communication skills. These are some of the things that are really hard for them to develop when they get into their practice, because a lot of times we've taught them really book level things, but we haven't actually taught them how to apply them into the clinical settings where they're working. And so when we're kind of looking at this, one of the things that like I know that the nursing program and probably other programs have been talking about is like practice readiness. And this is like an incentive that we've actually had to really emphasize in our program, is how do we graduate practice ready people? And some of the things that we kind of like really focused on, these are some of the elements of practice readiness. I think it's very obvious we expect students to perform clinical skills, obviously. But some of the things that maybe are a little harder for us to measure in our settings are like clinical judgment, for example. They expect them to be able to do clinical judgment, think through really complex situations and apply it in different ways. And that is not something that's really easy to measure in these environments. Communication, I think, is one that we often notice. I've only gotten like maybe 5 emails so far that I've looked at this week that were about like me writing bad test questions or something, I don't know. But so like communication, like even just being able to speak and have a challenging conversation with people, and then adaptability and bottom line professionalism. So when we were trying to think of ways that we can integrate this, we were just trying to think of ways that we can make these more practice ready graduates. And then this is what we were kind of tasked with. We kind of like working collaboratively with our simulation team, just kind of think of like ways that we could help integrate some of these different roles into current things that we were doing in our program. So we had our adult gerontology, acute care nurse practitioner students. This is a win for me because it's really, that does not roll off the tongue. So we're working with them, trying to figure out ways that we could add them into what we were currently working on. So one of the things that we really wanted to make sure that we were doing is making sure that we were integrating it in a way that we could it would be sustainable, I guess. And so we wanted to look at our existing simulations to see ways that we could enhance it for both groups of students, so that we wouldn't be like adding extra tasks to things that might be too expensive for like a smaller program to handle. And the other part is that we really wanted to make sure that we were looking at realism, very specifically like how, if we integrate this, like students would be feeling realistic scenarios in their practice, something that they might actually experience when they're on their floor. And overall, one of the things that was like a big goal for like us on the pre-licensure side is like overall improving their experiences. Because before one of this simulation, we integrated this too, they weren't actually having realistic experiences. They were having patients that were declining. We'd just be like, yeah, your provider will be there in an hour, which I will say this did happen to me during COVID a few times as a nurse. So this has been true, but we hope that isn't what happens most of the time. And so we really want to make sure that they have like authentic interactions with a provider in a way that they would be having those interactions. If they ask for help, they get help. And then we wanted to make sure that we were being very resource conscious when we were integrating this, like using existing simulations and existing things so we weren't adding to the extra budgetary requirements for students' fees and things like that. But overall, we really wanted all of these things to improve our student outcomes from our program. So those were some of our big goals. And this is just the last thing that I'm going to talk about before I turn over to Mandy, but just this is how we integrated. This was our simulation settings. So we did have an existing simulation where we mimicked a 20-bed acute care unit in our nursing program, in our pre-licensure nursing program that was done in their final semester. And so we had a need in that program to help improve the realism for these students. And so it was already part of our budget, already part of things that we were working on. So we have in this unit, we have 20 patients that are acute care patients. We have charge nurses, CNAs, unit secretaries, pharmacists, and pharmacy technicians. And then we had already a role for a provider, but we integrated our acute care nurse practitioners into that role as well. And then we also had simulation facilitators that were helping navigate this whole situation.
Thanks, Lisa. Okay, so let's talk a little bit about some of the things that we found, which is that simulation really can help enhance role clarity. So both of these student groups were able to actually practice in their future roles in a safe place and receive real-time guidance and feedback so that can help them with that transition to their practice that they'll be doing. We were able to give that real-time feedback in both roles to help add some clarity to what the practice requirements will be for both of those groups of students, both the pre-licensure students and the acute care nurse practitioner students. And the students were able to make changes in their plans using critical thinking and practice some of those really hard to measure skills like critical thinking, delegation, and time management. And so what we found is that these skills directly support student practice readiness because it prepares them for authentic clinical roles and team communication in the future, which we know can be so complex. So we also found that simulation strengthens communication. This really gave the students an opportunity to practice communicating with both the nurse practitioners and the pre-licensure nursing students. This was a stretch for both of them to step outside of their current roles, where many are potentially working as HCAs, or many of the nurse practitioner students are currently working as nurses, right? So this is a stretch for them to practice in that setting. And they were able to give that communication to one another in that role. This also helps reduce that fear factor. Our pre-licensure nursing students have fears of speaking to providers, right? And having a safe place to practice doing that and having a good first interaction can really help reduce that overall fear and then help see providers as partners in patients' care rather than being intimidated. And then lastly, it also helps improve collaboration through fostering a team approach to patient care and making sure that they know how to keep the provider and the nurses both in the loop on changes that they may have. So we did obtain student feedback in a few different ways. One way that we did was by faculty observation, and we did observation during the simulations itself, and then also we did faculty debriefings and with the students, and then also after the sessions. We also obtained input from individual surveys with the pre-licensure students on the event, and then also in our after class capstone classes, we did debriefings there as well. And then for the acute care nurse practitioner students, they obtained feedback in class discussions and individual debriefings as well. And now I'll turn it over to Dr. Favero.
So the students that participated in this simulation experience voiced some positive feedback and the benefits that came from this experience. As been highlighted by Mandy, Dr. Keddington, sorry, they felt better about those interactions with providers from the pre-licensure side. It challenged my AGACMP students to take the calls and make clinical decisions regarding the care of the patients, as well as the opportunity for both sets of students to interact with patients in the simulation. This enhanced the confidence on both sides, the interaction with the pre-licensure students with the provider, and also the provider in making those clinical decisions, and integrating the pre-licensure student into developing a plan of care and shared decision making, which we feel is so essential for both roles to have as they move forward into the practice setting. So there are challenges and obstacles with any sort of integrative experience. Or even without integrative experiences, we all experience challenges as faculty. Scheduling conflicts had to be considered. We have AGACMP students that had didactic and clinical obligations, as well as pre-licensure students with those. Oftentimes classes are on different days. It's hard to figure out what makes sense. The curriculum placement was challenging, I'd say, especially on the acute care nurse practitioner side. The pre-licensure students are admitted 3 times a year, so they have 3 different cohorts, whereas the DMP students have a single time admission throughout the year. So the AGACMP students, see, I even struggle with my own. This experience occurred at different levels in their academic experience. So I have students that are earlier and later with that happening, and with that comes the recognition of the need for more faculty support. The time commitment required of faculty and students alike is something that we always have to be aware of. And then repetition fatigue. We have addressed this some on the nurse practitioner side, where we've tried to integrate additional provider level decision making, giving results that they had been asking for, and then asking them to respond to those results. The lessons that we have learned are that we need to be mindful and collaborate in how we design these experiences. We work both as pre-licensure and graduate faculty to discuss what makes the most sense. We need to be iterative in our design. We've adjusted in real times if we needed, if something came up during this experience where there's multiple individuals there, that we can discuss and figure it out. And we've highlighted that this is the importance of investing in realism, and that how providing these authentic experiences. So as we look at this for the future, we'd love to explore additional collaboration. We have nurse practitioner students, pre-licensure students, but flowing into other disciplines. Pharmacy students, PA students, med students, therapy students, all of these are options in simulating an acute care experience in the hospital, and we would like to explore how we can do that in the future. We continue to collect student data, and as we collect that data, we're also going to respond and look to refine this experience. And then looking at the scalability, we're using existing simulations, we're ensuring that we are maintaining a cost-effective model, working with our simulation partners. And then I'd just say globally, I meant to bring it up a couple slides ago, that this really allows us as faculty to evaluate whether or not students are competent in these skills, where they're not soft skills. These are competencies they really need to meet to be able to practice. And then just this is our team that put this together, but recognizing that there's many other individuals that were involved in this process that were essential for making it the success it has been.
Yep.
And then we welcome questions.
Thank you very much.